Good morning. My name is Albert Jefferson. Can you say your name for the record, please?
Good morning, my name is Robert Wilson.
And what is your candidate number, please?
My candidate number is 221022100.
Thank you. And you are taking this test as a doctor. Is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working with a big team. I often find that different viewpoints can help me find solutions to a problem I might not think of my own. I also enjoy self-motivating.
Are you a team player? Tell me about a time that you worked well with a team.
I would say that I'm a good team player. As I said, I like to make sure that my team knows that I'm there for them, and I make sure to support all of my colleagues' decisions. One great example of this is when we lost a patient in my last job. It was really sad and unexpected. But I supported the physician I was working with and ensured her that she'd made the right call in terms of the medication. And I made sure that nurses in my team could share their feelings with me. We also talked about it later on to work out if there was anything we could have done differently. So, we turned the difficult situation into an opportunity to grow.
What are you passionate about?
I'm passionate about giving the absolute best possible care to all of my patients. I take pride in my work, and I am passionate about making a difference to people's lives.
Talk about a time when you had not communicated well. How did you correct the situation?
This often happens when there is a language barrier. I learned that it is always better to ask for an in-person interpreter, or utilizing computer translation software. This ensures there is no miscommunication of information. Unfortunately, hand gestures and speaking louder doesn't always work.
Why did you choose OET?
I believe that OET is the best language test that a medical professional can choose, as it deals with real healthcare scenarios, and I personally believe that every medical professional will feel confident while speaking or doing something related to the medical field.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now.
Hello, good morning. Myself, Robert. I'm one of the medical practitioners working in this clinic. May I know what brings you here today?
Hi, I am Albert Jefferson. I had consulted in this clinic for 2 months for the treatment of shingles that appeared on my neck area. And thankfully, I recovered completely.
All right.
But, unfortunately, I'm experiencing some sort of burning, tingling, and severe pain over the area which was affected with shingles.
Okay, if you don't mind, shall I assess the area?
Yes, sure.
For my clarification, shall I ask a few questions?
Of course.
Have your symptoms been continuous or occasional?
I can say that my symptoms are intermittent.
All right, may I ask you, how severe are your symptoms? For making it easier, how would you rate your pain on a pain scale of 0 to 10? Where 0 is no pain, and 10 is severe pain.
It can be considered approximately 5, and it's above.
I am really sorry to hear that. Anyway, don't worry, we are here to manage it effectively.
Thank you, doctor, but I am completely unaware of the cause of these symptoms.
Yes, your anxiety is quite normal. However, don't be panic. I can explain it to you. Your symptoms are because of postherpetic neuralgia. It is the most common complication of shingles. The risk of postherpetic neuralgia increases with age, primarily affecting people older than 60. This condition affects nerve fibers and skin, causing burning pain that lasts long after the rash and blisters of shingles disappear.
A complication of shingles? So, how long it will last?
Unfortunately, there's no cure. But treatments can ease symptoms. Still, there is hope that, in most cases, people with postherpetic neuralgia improve over time.
It is very hard for me to accept. Yet, I would like to know about the treatment options available for my condition.
I am really glad to explain it to you. But before that, I would like to know how long you are experiencing these symptoms.
It has been for the past week.
Okay, so, as the first line of treatment, I can provide you with some common painkillers, such as paracetamol or tramadol.
But, I wonder if my pain subsides with these medications?
Yes, I can also provide a capsaicin cream along with these medications. Capsaicin cream is made from the seeds of hot chili peppers, which might relieve pain from postherpetic neuralgia. This cream may produce some side effects such as irritation and a burning sensation on your skin. But, it usually disappears over time.
Okay, doctor.
An important thing that needs to be noted is, you should always wash hands and wear gloves while you apply this cream to the affected area.
Alright, but if you don't mind, can you give me some high-dose painkillers?
High-dose painkillers may lead to many side effects, addiction, and even death. And, if you are experiencing severe pain, I can provide you with some anti-seizure medications, including gabapentin and pregabalin, which could lessen the pain of postherpetic neuralgia. These medications stabilize abnormal electrical activity in your brain caused by injured nerves. However, it has some side effects including drowsiness, unclear thinking, unsteadiness, and swelling in the feet.
Okay, doctor. But I am afraid of taking medications for a long time.
I acknowledge your situation. Still, you are supposed to follow the medications until your symptoms are subsided.
Yes, I do understand the need of taking medication, doctor. If you don't mind, shall I ask you that? Is there any alternative treatment option available for this?
Yes, you can even go with some non-pharmacological management, such as protecting the skin from external stimulation by covering the affected area with a clear adhesive dressing. You can also use a simple domestic kitchen film wrap as an alternative for adhesive dressing. Secondly, stress, anxiety, distress, and disability exacerbate pain. Therefore, relaxation therapy and cognitive behavioral therapy will relieve the pain to a greater extent. In addition, acupuncture is also considered an effective pain-relieving strategy for a minority of people suffering from this condition. Are you following me?
Yes, I am.
Anyhow, you don't worry. As I said before, there is some probability of recovery over time. As well, an early diagnosis and treatment will yield the best result. I believe that you are here at the right time.
Yes, it started a week before.
Alright, so, what I advise you is to follow all the medications and suggestions properly.
Sure, doctor. I will do it.
I am glad to hear that.
Thank you so much for your time, doctor.
No mention. Visit me after taking these medications for the next 2 weeks.
Okay, doctor. Thank you.
You are welcome. Get well soon.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.